Hello, my name is Meiyi and welcome to my presentation on colorectal cancer screening. Today I'm going to dive into the importance of screening, especially for uninsured adults, and how we can work together to increase awareness and save lives. Colorectal cancer is preventable and treatable. But the first step is screening for adult age 45 to 75. Screening is essential to catch the cancer early on, even stop it before it starts. However, uninsured adults in this group are particularly underserved. Colorectal cancer is the second leading cause of cancer-related deaths in the United States, with over 132,000 new cases every year and approximately 50,000 deaths. What's even more troubling is that a significant number of these deaths are preventable through regular screening, but in uninsured adults are much less likely to get screened. Colorectal cancer doesn't affect all communities equally. Disparities are strongly driven by socioeconomic status and unequal access to early detection and treatment. For example, Black and Hispanic adults are less likely to receive timely follow up after abnormal screening results and are more often diagnosed at later, harder to treat stage. Even more concerning, American Indian and Alaska Native populations are the only groups in the United States where colorectal cancer death rates are not declining. Among Japanese men, the rates of colorectal cancer are 23% higher compared to non-Hispanic white men. These gaps highlight the urgent need for targeted education, accessible screening, and culturally responsive care. Screening rates for uninsured adults remain alarmingly low. Only about 23% receive recommended colorectal cancer screening. Several barriers contribute to this gap. First, lack cost is a major issue. Many simply can't afford a colonoscopy or other screening methods. Limited health literacy also plays a role. Some individuals may not fully understand the importance of early detection. Transportation can be another hurdle, especially in rural areas where clinics are far away. And finally, fear or stigma surrounding the procedure or possible results may cause people to delay or avoid screening altogether. Addressing these barriers is key to improving outcomes and saving lives. Colorectal cancer is the second leading cause of cancer-related deaths in the United States. As I mentioned before, if you have a family history, your risk can be 2 to 3 times higher than average. For the general population, the lifetime risk is about 1 in 20. But there's a hope. Thanks to the early detection and treatment, there are now over 1 million colorectal cancer survivors in the United States. This number shows how critical regular screening can be in preventing deaths and also improving survival rates. Several factors can increase a person's risk for colon cancer. Age is one of the biggest. Most cases occur in people over 50. Lifestyle choices also play a major role. For example, lack of physical activities and a lower fiber diet and a regular use of alcohol or tobacco can all raise your risk. And also people with a personal history of inflammatory intestinal conditions like Crohn's disease or ulcerative colitis are also at greater risk. And also, if you have a family history of colon cancer, your chance of developing it and are significantly higher. Understanding these risk factors is the first step toward prevention. And excuse me, reducing your risk for colorectal cancer is possible with just a few lifestyle changes. First of all, quit smoking and avoid all forms of tobacco. Second, stay active. Regular physical activities can cut your risk by up to 15%. Third, eat a balanced diet and maintain a healthy weight. Talk with your provider about nutrition and exercise plan that fits you. Fourth, limit alcohol and drink more water to support overall healthy. And finally, get screened. Screening is recommended starting at age 40 for some, and definitely for all adults age 50 or older. It can detect cancer early or prevent it. This year, around 50,000 people in the United States are expected to die from colorectal cancer. But there's the powerful truth. Screening could save more than half of those lives. So ask yourself, what if you could be part of the other half? The one who catch it early or prevent it altogether? Talk to your daughter about getting a colonoscopy. It could save your life. I used three credible sources to guide this project. The American Cancer Society studies page gives a clear picture of how serious colorectal cancer is, helping us understand why early detection is so important. The risk factor page breaks down what puts people at greater risk so we can better educate and empower our communities. And finally, the National Library of Medicine shares in-depth data on disparities, like how uninsured people and certain racial groups face greater barriers. Together, these resources offer both knowledge and direction for anyone looking to reduce their risk. Thank you for your look.